So we're just going to keep it on. Our next panel discussion focuses on the topic, lessons learned from the pandemic, leading in a time of crisis. Yes, I'm going to say the C word. The COVID-19 pandemic was not only a global health crisis, but also a catalyst for rethinking how we want to live going forward. So true. This opportunity included economic systems, sustainable development decisions, and a few shifts in the healthcare space, which have gone on to benefit all of humankind. The panelists next will provide a rundown of the lessons they learned while leading their organizations during such challenging times. Again, from my heart to yours, shout out to each and every one of you. I cannot imagine all of the challenges you guys have had to overcome the last couple of years. Let's hear it next for our moderator, Marcel Shaw, founder and CEO of Compassionate Solutions, LLC, who will introduce us to our panelists. Michelle? Oh, no, Michelle. Okay. Well, thank you. Well, we're just... Yes. Hi there. Hi, Dennis. Guys, round of applause for Dennis, my buddy. My new buddy. Thank you, Dennis, for taking over.
Yes, I'm standing in for Michelle. She wasn't able to be with us this afternoon. And want to bring up our panelists for this session. So if you would please come onto the stage and take a seat. And I know that the introduction itself has said that everyone here has been affected by the pandemic. Those here are now in survival mode. Well, hopefully we're beyond survival mode, and we're into a mode where we'll take the lessons we learned and apply them to improve our organizations, improve our lifestyle, and for the betterment of everyone here. And so I'm Dennis Dulniak, standing in again for Michelle Shaw, but I am the president of the Nana's Books Foundation, and happy to be here to moderate this session. And I'm going to have each one of our esteemed panelists here introduce themselves.
Would you like me to start, Dennis?
Please, if you would.
I'm Jack Doty, CEO of InnoCom Equities. We are an investment manager who brings money into the health world, life sciences more generally spoken. We do three things. We work as CEO advisors, we work as infrastructure developers and maintenance, and we also bring in capital. We're in the middle of raising a $250 million fund right now to invest in our now 12, probably 15 in the next month, portfolio companies. One of the points of distinction of our firm is that we spread the risk over those 15 by using a fund. Thanks, Dennis.
Very good, Jack. Thank you. Rebecca?
Hi, hello. I am Dr. Rebecca Johnson Osei. I am the founder and CEO of Concierge Psychology, which is a concierge mental health practice with a home base in Atlanta, an office in LA, and we also provide telehealth and concierge services across 33 states and growing. We were actually one of the very first concierge mental health practices in the country, although it has really caught on. It's a bit of a trend now, I think, which makes me very happy. But our focus is really on quality of care, so we limit the number of patients we take on to make sure that we can really focus on individuals and give them a little bit more of our attention than a typical therapist is often able to give just because of the demands that come with people who take a more managed care model.
Julio, please.
Yeah. Hi, my name is Julio Briones, and I am the CEO of the Briones Consulting Group. And we focus on strategic implementation for senior care industries, such as home care, home health, hospice, assisted living. We work with our clients to create custom solutions for strategic solutions to improve their marketing, operations, recruitment and retention, and to increase their overall business. We're currently based out of Indiana.
Thank you. Marcel?
Right, yeah, thanks, Michelle. Just kidding. Yeah, my name is Marcel. I've been 20 years in the healthcare industry. I'm in finance. I'm the chief financial officer of a rare disease company. We've got about 16 products on the market. And before that, I was working for an organ transplant company. So during the pandemic, working with organ transplant recipients. So that was during most of the COVID time, my sort of professional experience. And yeah, excited to be here.
Great. As you can hear, we have rather diversity in terms of their background on platform here. And I actually represent a different aspect of the lessons learned through the pandemic. My wife passed away during the pandemic. She had early onset Alzheimer's disease. Before the pandemic hit, I placed her in a memory care community after suffering way too much stresses on dealing with her as a caregiver. That worked out really fine until March the 14th. That day is for me very important because from that day I was closed off from seeing her for 28 weeks. She was not able to communicate by telephone nor iPad, and so the difficulty was extreme for me. For her, it was the isolation and separation from me that brought her disease even farther down. And I actually participated in many advocacy roles, which is something I want to talk about during my little discussion here, on being able to bring the information out that isolation does kill. I was featured in the USA Today article, interviewed several times, because it was important to get back into that assisted living center, memory care community, long-term care, whatever. In my wife's case, it was memory care, but I was not allowed to. Fortunately, our governor at that point identified and created an essential caregiver title. And our community where she was in allowed me to see her a limit of 1 to 2 hours a week. Again, that isolation, I saw the deterioration in her. Then COVID hit, she was placed in another unit and unfortunately was not able to survive that. She died from early onset, not COVID. But COVID itself and the pandemic is what really hit hard. And from that, I actually created the Nana's Books Foundation that now supplies books on Alzheimer's, dementia, and other disabilities to students in Title I schools, to their classroom libraries, to their school libraries, and the communities in which they are. This year, we're targeting 5 schools in 4 different states. Over 2,600 students will receive these books. And I'm here to really energize people on the fact that we have services now that can help families understand what dementia is like, because they're the ones impacted with their grandparents, their aunts, their uncles, not understanding as kids what this disease is doing. So I'm very, very proud to be able to honor my wife, who was a career lifelong librarian. And that is just something that is very, very dear to my heart, because after she died, it gave me purpose. And those of you who have experienced deep grief understand the nature of what a purpose can do for you. One of my soul lessons learned from the pandemic: have a keen purpose like this that focuses my energies and talents to be able to make the world better, make our communities better. And so I'm very, very proud of doing that. The other piece I learned was the fact that I actually attended a national caregivers conference where I became an advocate. That advocacy role is something that I do every single day. And one of the pieces I want to share with you today is an advocacy role you could help me with and help your community with. And that is being able to reach out to your congressperson. There is now legislation called HR 3733. It is the Essential Caregiver Act. The Essential Caregiver Act is an act that will actually allow the person in a facility to designate up to 2 essential caregivers that would be given access of up to 12 hours a day. 12 hours a day would be guaranteed unless they are in a terminal mode, which then they get 24-hour access. And that would happen during a public health emergency. Right now, all of those long-term care facilities, rehab facilities, memory care, assisted living, can have their own rules and regulations. We need to remove that isolation that affects hundreds of thousands of people who are in these units and allow them to have access to family members who can give them compassionate care, who can be there to assist them on a daily basis. And so I urge you to reach out to your congressperson. That act was submitted back in 2021. It is a bipartisan act with actually more Republican co-sponsors than Democratic co-sponsors. But I have a list here. If anybody's interested, I can see whether or not your congressperson has signed on. But those in the audience, please reach out to your congressperson. HR 3733, one of the pieces that I want to advocate very strongly for. Those are my lessons. I probably will share more. But Jack, what have you done with your company during the pandemic, and what has happened since?
Well, thank you, Dennis, and thank you for the advocacy you took on the House bill. My company was founded just as COVID occurred. That actually was not a crisis then, it was the opposite. Up until that time, I had recommended, worked as an advisor to the California Life Science Association. One of the recommendations I made as there was a dispersal of the senior management was that they no longer use the telephone, but rather they would use Teams or Zoom or other alternatives. That was beginning to happen in life science, at least in Northern California. Because of that, we had access to Zoom and were able then to build the organization around the communications possible with video as well as voice. Three things are kind of our mantra is empowerment, alignment, and then responsibility. You cannot give empowerment, you cannot give alignment, you can't expect people to be responsible if you're not communicating. So communications became the challenge during the COVID epidemic. We were able to do that through the Zoom techniques. We were gross amateurs, like everybody else, embarrassed to see our faces on the screen, embarrassed to hear our voices in that context. And gradually over these years, we've learned to live with the video alignment. That has enabled us to build our company around that. Interestingly, I have never shaken the hands of my partners. It's all been done by COVID. I'm sorry, all been done by Zoom. Because of COVID, it was possible then to expand, to have partners in Australia, partners in Virginia, as well as here in California. So that's the lesson that we learned, and we were able to maximize that. I'll go one more if I might, Dennis, and that is to say the opposite of those is something I'm very concerned about right now. That is, we don't have the personal contact. All we have is a picture of our coworkers as just a vision on the screen. The old days of getting together, I think it was recommended by one of the panelists, of getting together and seeing cohorts. In my case, it was a regular table at Lowe's in downtown San Francisco for a glass of wine that I kept busy 3 nights a week, which was really very pleasant. That died. In fact, Lowe's died during that period and removed their brand from the hotel. They're back as Four Seasons now, I'm proud to say. And we're beginning to reestablish that. But without the contact, personal contact, and the body language that you're able to read, the depth of the personal contact, I'm afraid that maybe there's going to be a real loneliness issue developing amongst all of us out there. Getting back to the office is probably what human beings need to do. Thanks, Dennis.
Very good, Jack. I'm going to go over to the end of the stage there because I think this is a great segue for Marcel to talk about what has happened in his company.
Yeah, certainly. So maybe I'll take it from a business perspective and then also from a work environment perspective, yeah, since I have a sort of a back office role there. So we have developed tests for organ recipients. Yeah? So a test that will basically tell an organ recipient, heart, kidney mainly, if the organ is rejected or not, or if it's in the stage of being rejected, and those patients have to be monitored very, very carefully, very closely, and very frequently. Also, people immunosuppressed and have to take a lot of medication, yeah, if you have an organ transplant. So what we had to do was, because those people couldn't leave their houses anymore, essentially, they were not allowed to go to hospitals. They were not like, they wouldn't leave their home. So we had to shift our business model, and as opposed to them going to the hospital, we actually delivered the test to them, yeah. So we sent phlebotomists to their houses. So we basically sort of catered to their needs during COVID, and just because we could not allow interruption of this type of service, and we had to suddenly work with things that we had never worked before. You know, how do you deliver a test, a whole lab basically to somebody's home? Yeah. So it worked actually very well. It was very successful. The company grew, where we went from 100 people to 300-400 people worldwide during COVID. Revenue up 100 million, 200, 300 million. So everything actually was an accelerated during COVID, and that posed a challenge for myself and my team. I've had about 30 people worldwide, finance department, and we became an accelerated filer from an SEC perspective, public disclosures. So everything had to be done faster during COVID, better quality, and then produce a 200-page report to basically tell our financials. Yeah. So that was a challenge already pre-COVID, and we had to adapt ourselves. We had to work, pull this through, and I would never ever have believed that it's possible to do all that in a remote setting. I made a conscious choice to go to the office every day. We were considered essential workers, and so we had to, some of them had to, but we did not have anybody sort of forced to come to the office. We said, just stay home if you want. So people appreciate the flexibility. But I made the choice to be there, just to be there if somebody needs me. But I think that was also a good decision, because people felt like whatever is working for them, they can work with it around. So there was a couple of years quite challenging, but we pulled it through, and you do things you never thought it were possible. Yeah.
So has any of the employees come back to the office, and what issues did you face there?
Yeah, and this is a little bit of a lesson learned, I think, for me and maybe also for the company. And we've a little bit too early asked, so to speak, to come back, the people to come back. And in California, we had these waves, so we had to pull back again, say, don't come to the office. Then we had go to the office, come to the office. So the long-term model is now still a bit in under sort of. Under review, and people have come back, yeah, part-time, so to speak, yeah, can still work from home maybe 2 days a week or so. So we've got a bit of a hybrid thing that will continue beyond the pandemic, I'm pretty sure. And the model works. People appreciate the flexibility, and I personally now work from home too, much more, and I save a lot of time with commutes, spending more time with family and all these things. So there's a positive that came out of that, I think, overall. Yeah.
Thank you. Rebecca, why don't you share your story, because you actually had teleprocessing or teleservices before COVID.
Yeah, and I actually want to touch on a couple of things you guys said. So we were lucky, I guess you could say, because as a concierge practice, it's important we be available when and where clients need us, which means you have a last-minute executive meeting, you can't make it in, but you don't want to cancel. I need to be able to do video or phone. But it was, a tiny percentage of the time. It was maybe once a week or so we'd shift, and it was always intended to be in person. But thankfully we had that, and then we've been paperless for 7 years or something. So we already had all of those processes online already. You could sign your consent forms. So for us, it wasn't hard to shift from an administrative perspective, which I know a lot of mental health companies actually struggled significantly to make that change. But clients were still hesitant, especially in the beginning. People wanted to say, well, we'll just wait until the pandemic's over in a month or two, because we all thought this was only going to last 2 or 3 months. And so there was sort of a convincing people. I imagine this is most of the healthcare industry, saying to people, no, it's still effective. I can still help, I promise. And people have become much more comfortable with telehealth over the last 2 or so years. And more people actually reach out now asking for that, for the flexibility piece. It's hard for me to get away because commuting is a thing. For most people, it could be an hour total, 30 minutes or more each way to get to the therapist's office, or if you have kids but you have a quiet place. At the same time, with the proliferation of telehealth, you have people who maybe aren't getting out of their stressful environment. So I've had people where they really need to talk about their spouse, but they both work from home. So, they're like I literally have had somebody sit in a closet and talk to me, and that sounds super unhealthy, and it's not as bad as it sounds, but just to feel like they had privacy, or away from their kids, same thing. Just getting away, you talked about the cost of sort of always being on with people and being able to literally get away from the rest of your life and the chaos and be in a place that's grounded and calming, which of course we aim for in a therapy office, in of itself can be really healthy. So I think it's pros and cons. We've seen more access for people. You were talking about legislation. There's legislation on the books in a number of states at the moment for something called PSYPACT. Nevada, I think, is amongst that group. But 33 states have signed on. And so if you're in any of those, a therapist in that state can essentially get an additional credential, allowing them to do telehealth in any of the other 33 states. So this also helps with people in business, for example, who travel for work. Because technically, if you live in Nevada and you go to like Ohio for work, you can't talk to your therapist because they're not licensed in Ohio, most likely. But if both states are part of PSYPACT, now you can. It's not so rigid. And there's ways we handle crises, but as a general rule, you wouldn't have that support. So there's been a lot of growth. A lot of people have added to it. The one other component, and it was interesting to hear both of you give your perspectives, you mentioned isolation. And I think as there's that for therapists in addition, and for the patients who are not necessarily getting the same kind of interpersonal connection. I think therapy can be very effective, but it can feel different to not sit there with somebody. But we also see a little bit more burnout for the therapists. So they've done some studies, and really empathic people, we read body language. I think you had mentioned not being able to see body language. And you take all of that in, and most therapists are very empathic. With a little screen, I can't see if you're doing this, tapping your foot, shifting uncomfortably. Am I triggering you? I have to just read your face. And that's hard, and it's exhausting. We don't realize we're doing it, but we're very focused. And so yes, therapy is very effective for the patient, but for the therapists, it's like twice the amount of work. So you're seeing mental health people actually, I think, burning out a little bit more. And again, same thing. Sure, we can work from home. That's convenient. That's great. But then what are we doing? Just like everybody else, then we're going downstairs and helping the kids or what have you, and also not getting that, because again, going into the office, like you mentioned, going into the office itself can actually be sort of if you have a healthy office environment, it can be an escape itself, right? So it's very interesting. You kind of get both sides of it on our end.
Great. Thank you for sharing. Julio, your situation is a lot different from discussing this with you. Would you please share?
Well, in the senior care space, especially when we're talking about field workers, home care, home health, hospice, even some of the more independent, like wound care clinics that have to send people out to go visit people at the home. One of the biggest challenges in that industry has been the need to have people work from home because they're not considered essential field employees. So you have an entire workforce going out to visit these people that desperately need their help. I mean, these caregivers, these nurses, they're amazing. They serve a very vital function, but now they lose connection with their internal office because now you have nobody there to come to. When you need to find PPP, when you have to just vent about your client, when you have all of these other normal issues operationally, there's no one to come back to, nobody to discuss these issues, and it's creating a big problem in the labor force within these industries. Everybody has heard of the caregiver shortage out in the field. There's not a caregiver shortage, okay? What's actually going on is that caregivers feel disconnected from their home office. So they're finding it more lucrative to go out and work on their own, even at a higher risk to themselves. So they're no longer covered by the workman's comp. They no longer have anyone to manage the schedule. There's nobody to protect them from an abusive client and there's no one to protect the client from an abusive caregiver. So this is becoming just a massive problem, and trying to rein this all back in is the biggest challenge that's actually going on now. You know, there was a lot of deregulation in a lot of states. Like, I'll give a good example. In New Jersey, for example, there was 2 distinct licenses for caregivers. You had CNAs that could only work in facilities, and you had certified home health aides that could only work in the home, right? Person can go and get both, but they had their own functions. So during the pandemic, because of this artificially created caregiver shortage, they relaxed the rules, and now CNAs were able to go to work in the homes, and home health aides were able to work in the facilities and perform the same functions. And this is causing a lot of burnout because there was nobody to come back to, no structure, no order, and people were out getting the clients privately. So there's a lot of inherent dangers with that, both to the client and to the caregiver. What happens when you have no coverage? So what happens now when you also have an office team that has spent 2, almost 3 years, that they've gotten accustomed to I call it the fallacy of underperforming, okay? The expectation when you work from home, for many, not in all industries, but in this industry in particular, it's a lot of just being on the phone. So they're used to taking the phone, they'll work, from 10 to 2 instead of 9 to 5. All of a sudden, everything becomes on call, and they think they're working just as hard and being equally productive, and now they're being asked to come back into the office, and people are having meltdowns. They're just they're not able to get back to that normal productivity level. I mean, at best, we can look at 60-70% productivity from most of your office staff, about 80 to 90% productivity from your field staff, and these numbers are dramatically dropping, and this is one of the biggest challenges that this industry, especially with the field workers, is facing.
Great, thank you for sharing. I know that we learn from making our own mistakes, or correcting our mistakes. And so one of the questions I'll have each of the panelists respond to is, what mistakes did you make and what did you learn from them after the pandemic?
None.
Thank you, Rebecca. Exactly my point. Yes.
Absolutely.
Would you like me to comment to that?
Sure.
Okay. The not understanding how difficult the communication is on video, and not being patient with it. Also getting tired and not realizing that's part of what we have to tolerate. So basically being forgiving, one of those great admonitions of the process of communicating in spite of its difficulty.
I'll piggyback on that, and I'll add even a component of that, but boundaries actually I think became a little bit harder, and actually kind of speaking what you just said, because we're all kind of feel like we're on call, I think, to a degree, and so you're more flexible, but what does that really mean? Now it somehow means you're answering the phone until 7. That's what, my schedule's more flexible. And I think that's everybody. I think that's kind of across the board. And again, back to burnout potentially. I mean, sure, it's easier for me to run to the store at 2 o'clock in the afternoon, maybe if I have a hole in my schedule, because we really couldn't do that when we were in the office in a lot of cases. But now you're working late, and how do you say no? And a lot of employers expecting that. There seemed to be this shift of, you don't have to drive from 7:30 to 8:30 anymore, so you can be on meetings at 7:30. And again, less so for me, but I hear it with clients. A lot of people I work with are executives, and they're burning out because they're actually working, I don't even know if it's more hours, but it's stranger hours. There's no boundary to box in, I'm home and I'm off versus I'm on. And so we're just all on all the time, regardless of how many hours you're actually spending in front of a camera. And I think that is very hard to just yourself. And of course, when you mentioned productivity, and this is not to say that it's the truth of your company, but in the United States, we have some toxic productivity stuff going on. And so we all tend to think, what's a good day? A productive day, right? Look at all I got done today. And so without concrete boundaries, a lot of us will actually overwork. We'll do more as opposed to less, and that's not good either. And then we probably end up netting worse, because we all know if you burn yourself out, now you're actually less productive. but I'm a therapist.
Julio,
All right, yeah.
Marcel?
Yeah, so one of the biggest mistakes I made when COVID first started, it was the way I was interacting with the CEOs and the owners of these companies, right? So we tried to take the same approach of pre-COVID and how to manage and structure the internal team and apply it to a work from home environment or from a skeleton crew environment. You know, and what we figured out, and my team figured out when we started learning this, and thank God we were able to fail quickly at this, okay? Because we had to learn that you cannot address an office environment with the same values as you will when you're dealing with the individuals outside of the environment, all right? So you have to take a more customized and a more personal approach in order to maintain that retention of your office staff. Because look, at the end of the day, especially if you're running a field team of 50, 60, 70 employees that you have to run 24 hours a day, 7 days a week, you know, if your internal staff, your scheduling staff, your nursing staff, your administrative staff is not with you, they're not seeing that vision the way they're supposed to with you, then you're going to lose control of the entire process. We've seen throughout this process companies that pre-COVID were doing $30, $40 million in billing, all right, drop down to below 8, you know, just because their staff internally, they lost control. So they lost control. All of a sudden, they can't keep the internal operations on track, and those people lost control of the field staff. And at the end of the day, and this is something that's very personal to me, they started providing poor care to those that desperately needed it. And so learning how to teach these CEOs, these owners, how to take that top-down approach, no matter what you're doing, instill your values, understand your core values, what made your company great in the first place, and make sure that it gets translated properly to all of these individuals, all these moving parts working out of their house. It made for a better work environment for the caregivers and better outcomes for their patients.
Great. Marcel, any mistakes there?
Yeah, I mean, along those lines, from a people management perspective, other than communication, the challenge was at the beginning to maybe almost a little bit over-communicate, having one-on-ones, another one-on-one, another phone call, and then where do you draw the line between micromanaging somebody versus communicating with them or over-communicating? So to sort of adjust that and customize the communication style to everybody is very important, that you address the needs of every individual. One thing I didn't pay attention too much at the beginning, but I thought would have been better to do is, it's tough for people who are already in the company. It's even harder for somebody who gets onboarded. So the whole onboarding process, somebody we've never met, somebody we've never seen. So also to customize that, because there's a big difference. Somebody who's a bit more senior, a senior person who has decades of experience, he can onboard almost a little bit himself. It's like him or herself. It's more like to say that person doesn't need a lot of guidance. But for somebody who's junior, for a senior analyst or somebody who's just joining a company after university, for example, it's really, really difficult for somebody who is getting into a COVID environment, into a company. How do you onboard somebody like that? So to customize the onboarding procedure, depending on the level or depending on the needs, to make him productivity, get him up to speed, her up to speed very quickly. So that is something that we should have paid attention to a little bit earlier, and not when it's too late, when somebody just leaves again after 6 months because they just didn't know how to operate in a company like that.
When it comes to management, conflict enters into it among your employees or staff. Any unusual circumstances or different procedures you had to employ, either during the pandemic or thereafter? Jack?
Thank you. It's one of my favorite topics. Our partners are all strong-willed previous CEO advisors themselves. All of us have been CEOs. So you can imagine who wants to be in charge at any given transaction. Fortunately, in our case, the attribute of grace has been shared amongst the three of us. But that conflict is really, really a difficult thing to handle. And you can't walk back and say, hey, I'm sorry, Jules. Here's a cup of coffee and can I patch up? I mean, it's in Jules' case, he's in Australia, and I talked to him at 4 o'clock my time, which is 8 o'clock in the morning his time, And you can imagine how that amplifies. What we learned was, though, the good grace itself could then come in and with the little patients come back and apologize for each of our part of that transaction. So that was a lesson learned, but if not, it would have just completely destroyed the organization. Very important lesson, and only because we could have all the tools called Zoom and email, which I didn't mention email in my earlier comments. I guess I'll avoid that subject.
How about texting? Was that an option too?
I just deny texting. I don't respond. There's a word called stop. You just
Any other conflict resolution procedures that were employed among the other group?
Yeah, actually, one of the big challenges that I found in my industry in particular was you had office managers that worked under the CEOs that now felt lost in the space because they had nobody there to manage. All right, so a lot of times people ended up leaving because a big problem, especially when you're dealing with a lot of field work and multiple schedules, is you have to deal with a lot of in-group, out-group behavior. All right, otherwise known as cliques. You know, like remember back in high school when you had the jocks and the nerds and this and the other. That happens a lot, especially when you're managing large groups of low to medium skilled labor that has to go out and report to somebody else. Everybody has their favorite. Oh, this person will always respond. That person, they're a great worker, but I don't really like them, and people get lost in the shuffle. And one of the organizational structures that needs to happen is this manager who's taking the one rung lower from the CEO has to be able to control that with a scheduling staff internally. And without that physical presence, a lot of them fell apart. They just didn't know how to manage that, and it led to a lot of, again, loss of control and a loss of the mitigation of that in-group, out-group behavior.
Very good. We're going to be getting into question and answers from our audience out here. So if you'd cue yourselves up, we'll be able to address any of these wonderful, talented people up here with your questions, perhaps sharing a lesson you learned from the pandemic as well, because those are as diverse as the panel itself.
Hi.
Hello.
This question is for Dr. Rebecca. I was curious within your particular market, how you mentioned the demand across the board going up for more flexibility, right? So I'm wondering how available you or your staff or your offices have made your schedules to this rise in demand. Is it 9 to 5 officially, or are you being more flexible along? What has your decision been, and how has that? What have the results been?
I gotcha. Well, this is another thing where I'd say we actually didn't change that much. So the way my practice is scheduled, each of my therapists essentially manages their own calendar, and I do give them the flexibility within reason. So relatively 9 to 5. We've kind of always been more of like a 9 to 6 or 7, depending on the person. We've always been available after hours. I've occasionally taken a call at like 2 in the morning or on a Saturday, but thankfully those are very rare for existing clients with emergencies. We're not an emergency line, but pseudo crisis level. Don't need to go to the hospital, but could really use some support. But for the most part, we've stuck with a relatively 8 to 6 Monday through Friday as our standard. But modality being super flexible that way. We also, and again, we had this before anyway, but we have effectively a 25-minute cushion between appointments. So if people are running late, so if you guys have ever been late to a massage appointment, they don't make up that time, right? You have a 60-minute massage, now it's a 50-minute massage, and now you're stressed going into your massage appointment, and it's horrible. That's what I envisioned when I made my practice. So I always, you don't need to show up 25 minutes early to sit in the waiting room and wait for your doctor who's then going to be late. I say, hey, I can wait for you. You don't need to wait for me. So we encourage people to be as on time as possible, but not stress if you're a few minutes late, because we can always make up 10 minutes. And I think that allows the flexibility. We try to, even if we need to reschedule within the same day, back to my example of, we have a lot of executives, meetings, emergencies come up, things you can't avoid. And if I can nudge the appointment an hour and still see you, that's what I'm going to do. But a lot of that honestly was already in effect. So again, it's actually worked out nicely for us. But just trying to also be really flexible. We have three different backups for our video system. So if one isn't working, we're on to the next one. Because I have found that's really where a lot of the issues come up, is somebody signs on to what I use and they can't hear me. And of course they can't hear me because God forbid things worked properly, right? So just having that flexibility to find, okay, if this doesn't work, we're gonna try this. And worst case scenario, we're gonna get on the phone, but one way or another, I got you. Does that answer your question? Okay.
Very good.
How have you guys managed burnout for your employees during COVID?
Start here, Jack.
Good question, and poorly, I think, was the original answer. You didn't understand exactly what Rebecca was talking about earlier, that we could be getting calls anywhere from 5 in the morning out of New York, which is 8 for them, that was fine in San Francisco. But at the same time from Australia, we could come in at 10 o'clock that same day, and call or emails, and each of those have a sense of urgency. So how we handle that was, in fact, one of those conflicts I described earlier. Jules, don't send out emails on your Sunday or your Monday night, which is my Sunday night, at 7 o'clock, because I do scan to make sure there's any emergencies. It took a lot of effort to get an appreciation for each other's need to rest and have that compassion.
I've had to sort of institutionalize breaks, actually. We have it in our contract. I don't know if that's normal at all, but because people, I think, again, there's like this pressure we have to be available all the time.
Yes.
And with therapists, I truly believe we only have so much space. And anybody in here who works in mental health, it's, for whatever reason, everybody has a breakdown like the same day. Everybody can doing great, and then you get like 6 in a row. And you're like, what? I swear there's a text chain. I don't understand. And so I actually mandate that my staff take, I call it a lunch break. I'm like, I don't care what you do with it, but you have to take this 1 hour break, because in truth, you're not going to be an effective therapist either if if you've just met with 5 people who are all breaking down in a row. Number 6 is not going to get a great version of you. So I use it as we provide better service by doing this effectively. And I think this is true across fields. I think when you are healthier, you provide better service. You're a better worker. So it's a win-win in my mind. But I have had to tell, especially people with those overachieving personalities, and I have to be like, you have to slow down. But I used to do 12 clients a day. I don't care. You can't.
Well, I actually do something similar to what she does. I have it in all my employment agreements that they must take 2 weeks vacation every year. There's no ifs, ands, or buts about that. And also because I work more on the business side than anything clinical, and I do see clients around different parts of different countries. So I have a simple philosophy in my business. Your lack of planning does not constitute an emergency for me. So if you have something that needs urgent attention in your mind, we'll look at it and we'll figure out what the solution needs to be. And then we decide if it's really an emergency or not. And any calls that do come in, my staff knows, if it comes in on a Saturday at 6 o'clock in the morning, send it to me. I'll decide if it's an emergency. If not, the client can wait. And that's really what it comes down to.
Discipline.
Yeah, so Mike, I have a good friend of mine. He's a psychologist, and he's treating burnout patients. Yeah, and his own workload during the last 2-3 years just exceeded his own capacity as well, and he actually ended up in a burnout clinic himself. And what he said is it's a new form of burnout also. So it's not like easy detectable. It's not like we know how to a burnout really like progresses now. The pandemic has just shown it's really, really hard, specifically in a remote environment. Yeah, so you have to almost be a psychologist yourself to really understand every person, how they feel about it. But yeah, it really comes back to giving buffer zones, not again emails. Email can be like a stressful thing if people just send an email less, make a phone call less, don't call over lunchtime. So just respect people's time, essentially. At the end of the day, respect people's time. ask them to take a vacation, yeah, and obviously never deny any of this. So there's no silver bullet. I think it's more like being sensitive to everybody's own situation. Yeah.
Thank you.
Hi. First, Julio, you
Yeah.
were singing my language back there. I was so excited. I thought I was the only post-acute care person in the room. So, so my first question is directly to you.
Okay.
How do we gain the productivity back? Because I run home health and hospice, and it has been a dramatic decline. Like, again, it's like everybody's, I mean, what a team of 4 were able to accomplish 3 years ago, now it takes, 6 people or 7 people. And the numbers aren't increasing. It's not the visits. It's just, again, it's that productivity that just got so bad, with all of us just trying to figure it out. I mean, at one point in time, we threw out our emergency preparedness plan and just replaced it with a Stephen King novel, because we're like, well, the rules are changing every day. What's the point? And then for the entire panel, my second question is, do you think the pandemic was enough to start actually openly having conversations, program development, to start addressing global burnout? Was it enough, or are we going to need more before this little dirty healthcare secret, gets addressed? Because we're seeing global burnout, and for the people in the room that don't know what global burnout is, that's when our practitioners, our clinicians, they throw up their hands and they're like, screw it, I'm gonna go work at McDonald's, and they do. They don't just leave for a little bit, they leave forever. So those are my 2 questions.
All right. So let me ask you.
I'll pass it to you in a second.
Oh,
okay, if I just might. Well, that question was about health workers. My world is not in the health work, and so I don't have that issue. In fact, it's the opposite. We have geniuses who have cures for cancer and for long-term COVID and for all these other stem cell problems and so forth. And they are dedicated to do it in spite of, and they're not responsive. They are in fact proactive, and I think that might be the solution. Thank you, Julio, for letting me say that.
All right. I actually have a clarifying question for you, so I can answer you properly. When you're talking about returning to productivity, you mean office staff or field staff?
It's really both, because it has been a combo, right? Because, you let people out in the wilderness unsupervised for long enough.
Right.
They become feral, they make their own choices.
Yes.
They change their
So
Feral is what they are.
in the interest of time, I'm going to address this as quickly. The second part is actually very easy. The field staff, you answered your own question. Set up a position in your company for a field supervisor and implement something that we can talk about it after. It's called quality assurance. Okay, but not state mandated quality assurance. It's a very specific kind that I will happily discuss with you after. All right, now as far as your office staff productivity, create a bonus system, because I deal with this a lot. I have about a dozen clients, and I was actually, since 4 this morning, sitting out there waiting to have a meeting with the panel, discussing this very issue. You tie performance to a bonus, okay? So as long as you make their pay based on their ability to produce, then you create and structure it in such a way that they can be the only ones to take it away from themselves. So let's say, for example, you set up a KPI for your recruiter, okay? Let's say you need to recruit, hire, and onboard 10 caregivers and 5 nurses, okay? That's your minimum standard. If you don't meet it, you lost your bonus. If you meet it, great, you've got it. And now if you exceed it, let's take a look and let's prorate it accordingly. Okay, so they have their base pay that doesn't change, but if you tie it to a quarterly bonus structure, some sort of incentive program, now it becomes merit-based, and it'll bring back that motivation. And I've had a tremendous amount of success with this, implementing this in a lot of my clients, everything from small home care agencies up to larger skilled nursing facilities.
Very good. David, I'm sorry, we are out of time. All the questions that came for the panel has really exceeded the time allowed for this session. So all panelists will be available outside the booth here, or the stage. But I want to have you share appreciation for them, their responses, and their preparations. Thank you.
Thank you, Dennis.
Thank you, everybody.
Good job, Dennis.
Thank you.
Good job.